I think in Australia, just to be brief about it, we are behind you in Europe and in America, perhaps because it's been summer here and the virus hasn't yet taken the grip amongst the community that it has taken in the Northern Hemisphere. We've had 21 deaths in Australia, and we don't believe any of them are Jewish. About 4,000 who are ill, not members of the community, 4,000 people. We think there are a handful, a very small handful of members of the community who are in hospital. The hospital system is still coping well. We have a system of public hospitals as well as private hospitals, and the government has just brokered an agreement with all the private hospitals joining in with the public hospitals. So there will be a dramatic increase in beds and in ICU facilities. So they're not at this stage being overrun at all. The government has also announced enormous financial package of benefits to the community, almost a living wage for everyone who might have been unemployed. So that although there was an enormous shock and a lot of facilities closed, whether it's all obviously travel and accommodation and catering and food and restaurants and all of that's been closed, many people have now will get this wage, and so the economy might be less, affected than otherwise. The country's not in complete lockdown yet, but almost so. Everyone over 70 is urged to stay at home. All public gatherings have ceased. And as you know, we're made up of states, and some of the states have closed their borders to other states. So in terms of the community, the ECAJ has its constituents around the country. We have had hookups ourselves and are coordinating what is going on in each state. In the most populous state, New South Wales, where I'm located, we have activated the Jewish Emergency Management Plan, which is a sort of a general emergency plan, which could have been there for other kinds of crises, but it's been activated, and there's an emergency operations center that is staffed 24/7 with one call number, so that anyone who is in need, whether it's for food deliveries, whether it's for health issues, whether it's for mental health issues, can call this number, and it's linked into various service providers. And that is being funded. We have a communal funding organisation, and it's being funded by that, and they have set up an emergency funding from reserves for all those in need. Obviously, it's not quite the same in each of the states, but we've had a hookup, and would appear that they are all managing. Obviously, the same as has been stated by everybody else. The synagogues are closed. There's social isolation. People are using Zoom. Seders will be by Zoom. Funerals have to be restricted in terms of numbers of people and so on. But the worry, we have put out a number of videos. I have done a video which has gone around the country to the community to warn them that because of our closeness with family, we are particularly vulnerable. And the big issue has been that grandparents should not be seeing grandchildren if they don't live with them permanently. And that has been a major stress. But we've had videos produced by health reporters and a mental health expert. So we are trying to cater for all aspects of the community. I think that we have the same issues with anti-Semitism online, but it perhaps hasn't been as intense as in some other jurisdictions.